Hello everyone, and welcome to my presentation on phantom limb syndrome. Today I will be covering what phantom limb syndrome is, its history, symptoms, brain changes associated with it, as well as how do the changes and symptoms fit within a larger context of brain function, and what can they tell us about brain function as a whole. Phantom limb syndrome, unlike many other syndromes that we will be talking about in our class, is different in that the symptoms directly are tied to damage that is coming from non-brain areas, such as the limbs, which makes it a bit of a unique case. And before we begin, I would like you to draw attention to the feeling and sensation in your legs. I'd like you to go in without looking, feel the pressures and the forces that are acting on them, feel yourself pushing into the floor, for example, and feel where they are in space and the sensation you can feel that they exist, the proprioception. Now, with this in mind, I'd like you to imagine that when you try to go and stand up after this amazing presentation, that you will fall through the floor and your legs will feel as if they're going through water instead of actually supporting you. This kind of weird feeling will be what it is like to actually experience phantom limb syndrome. And these are some of the odd sensations that one can go and experience because of having the syndrome. But what exactly is phantom limb syndrome, and where did it come from as a concept? Phantom limb syndrome is a neurological disorder in which the patient feels sensations and pain in a limb that is no longer there, either through amputation or through being born without that limb. It was first noted on in the 16th century by surgeons that were working in the Civil War. In this time frame, there was a multitude of amputations happening. Tens of thousands of men that were fighting were having very, very fast amputations. And many medical practitioners at the time, especially those that were doing surgery, were noting that those who had experienced amputation were then going and complaining about sensations of the missing limb, as well as feeling pain within those missing limbs. But at the time, much like shell shock in World War II, it was seen as hysteria and as an excuse to escape from military duty. However, in the late 1800s, phantom limb was coined by Silas Mitchell. He saw phantom limb syndrome as an issue of the peripheral nervous system. And the dominant hypothesis was that irritation to the peripheral nerves at the amputation site were causing the sensations and the pain. However, by the late 1980s, Ronald Milzak had recognized that the peripheral neuroma account could not be correct because many people that were born without limbs also experienced phantom limb pain and sensations. It happens in almost every amputee, and though still not understood, it is not related to age, sex, or how the limb was lost. So what are the sensations and feelings that might be associated with phantom limb syndrome? The symptoms associated with phantom limb syndrome can be divided into two sections: sensory sensations and pain sensations. Sensory sensations are when patients experience the sensations that the missing limb is still present, such as itching, tingling, or feeling of movement. These sensations can feel so real that a patient can act as if they're still there. So like the example before, trying to get up and walk on a non-existent leg. They can also experience telescoping, which is the limb shrinking into their stump. These sensations are defined by three main types. There is kinetic, so movement in the absent limb; kinesthetic, so the shape, the size, and the position of the limb, and you feeling that and still thinking it's there; and exteroperceptive, so for example, feeling you're touching, there being pressure, or there being temperature in that absent limb. I actually had the opportunity to talk with a person that has phantom limb syndrome, who is para-Olympian for Canada, Andre Navarez. Andre Navarez had a paralyzed leg on his left side, and on his right side had to have his leg amputated because of a crash. He experiences the sensation of his missing limb still fully being there, and has often at times where he tries to go and walk upstairs or forgets to put his prosthetic on because he still feels as though his leg is there. As seen in the picture, he mainly feels it in the most sensitive areas such as his foot, but it can also be experienced as the full limb. So what about these pain sensations? And how are they different than the sensory sensations? The symptoms of phantom pain are experienced by almost all people with phantom limb syndrome. However, this pain is very individual, and it differs quite drastically in how people experience the pain and the intensity of the pain, as well as stressors. As seen in the figure, the pain can go and manifest in many different ways. It can manifest in a sharp shooting nerve pain, burning sensations, crushing sensations, twisting sensations, elongation sensations, and cramps in the limb that is missing. Furthermore, these sensations of pain also vary in intensity from person to person, with some people having none, and some people having pain so bad it can cause suicidal urges, and in some cases, sadly, suicide. Pain is also triggered by many different things, such as sex, barometric pressure, physical touch, inactivity, focusing on the missing limb, and other factors. However, it's most often felt by all individuals in the most sensitive areas of a lost appendage. For upper limb amputees, the hands and the fingers, and for lower limb amputees, the foot and the toes. For Andrew Navarez, the Paralympian amputee, he experienced feeling the pain primarily when he's sitting on a chairlift due to long periods of inactivity. But as soon as he went and was actually doing his sport of skiing down the hill with his prosthetic, he felt almost no pain. So the difference in cognition of what he was focusing on really affected the pain he was feeling. He even said that he felt more pain when he was focusing on the stresses of trying to get a new mortgage as compared to just sitting at home normally. But what are the causes of these sensations? And how can it be that someone can feel something in a limb that does not exist? There is no clear consensus in their literature for what exactly is causing these sensations in phantom limb syndrome. But we do have a better idea of what is causing the pain, which I will discuss in my next slide. However, the main theories dealing with sensations focus on the somatosensory cortex, which usually maps for sensations for different body parts. As seen into the figure to the left, on the left side of that figure is a normal healthy somatosensory cortex, which has a focus on the most sensitive areas and doesn't focus as much on the least sensitive areas as a full map of what's going on in our sensations for our body. Now the first theory posits that the somatosensory cortex, which normally maps for these sensations, continues to receive signals from areas of the body that are no longer there. These junk inputs or signals cause sensory feedback, and when a limb is amputated, the nerves that previously sent sensory information from the limb to the brain are still present. These nerves may send signals that the brain interprets as coming from the missing limb, even though it's not there, causing these sensations. Another theory is the reorganization of the brain, or cortical reorganization. After an amputation, the area of the brain that is used to process sensory information for the missing limb may get reorganized. This can be seen in the figure to the left, that as the hand is missing, cortical reorganization happens, and this map then gets converged onto that missing area. However, this process is not perfect, and so the brain may start to receive input from neighboring areas such as the face or remaining body parts of the body, leading to the sensation of that missing limb. So the overlapping of these new and past sensory maps being imperfect causes this issue. This hypothesis was illustrated by showing that stroking different parts of the face led to perceptions of being touched in different parts of the missing limb. And later on, brain scans of amputees show the same type of cortical reorganization that researchers had observed in monkeys that also had that missing limb. So that kind of explains what's happening with the sensations, but what is exactly happening with the pain felt in phantom limb syndrome? So we seem to have a lot clearer of an idea of what exactly is happening with the pain symptoms associated with PLS as compared to the sensory symptoms. The main theory is the neuroma theory. Neuromas are abnormal growths of nerve tissue at the site of an amputation and are the main hypothesized cause of pain in PLS. As we can see in the figure, when a nerve is severed, a neuroma will try to grow out of it and grow into the missing limb. Because it no longer exists, the nerve fibers will get bundled up. The issue with this is that these neuromas can generate spontaneous nerve activity, which can be interpreted by the brain as pain coming from the missing limb. Another possible theory is that the brain's attempt to remap sensory information can cause pain pathways that mimic the sensations of the old limb. So think cortical reorganization gone bad. These junk inputs are then going and causing pain signals. This concept of cortical reorganization gone bad leads us to thinking about how does phantom limb syndrome fit within the larger context of brain functions, and what can it tell us about brain functions as a whole? So it seems that in PLS, when the patient's body is damaged, the brain is trying to go and reorganize in order to help the patient adapt to the new situation and relearn a way to go and operate without that missing limb. This is the concept of neuroplasticity, which is the brain's ability to reorganize itself by forming new neural connections after an injury or loss. Specifically, cortical reorganization is a subtype of neuroplasticity, specifically referring to the brain's adjustment of sensory and motor maps in response to an injury. After an amputation, the brain attempts to compensate by remapping these sensory motor areas, which allows the individual to adapt to their circumstances and to relearn skills. This is what adaptive neuroplasticity is. This reorganization can help the brain maintain some sense of bodily awareness and function despite the loss of a limb, as well as help the patient adapt to the loss by developing a new skill set and pathways to complete motor tasks. So in Andre Navarre's case, this would be learning how to go and ski with a prosthetic. Or this can be seen in people born without arms, learning to use their feet as their main appendages. However, there is also faulty adaptation. The brain isn't perfect, although it is mighty, and it can remap inappropriately, leading to the perception of phantom limb pain or failures in cognition, so for example, trying to use that missing or non-existent limb, and demonstrating the brain's imperfect adaptation process. Phantom limb syndrome demonstrates how amazingly adaptive the brain is to go and overcome and adapt to a massive loss by reorganizing structures in the brain. And it also shows how sensory and motor systems are super interconnected, with signals from the motor systems allowing the brain to reorganize itself to best help the individual. However, as I said before, it also highlights the imperfection of these brain systems. And it also highlights the necessity for studying the brain and ways to help the healing process. So the brain can do a lot, but we can also help it heal. This, for example, especially in phantom limb syndrome, is done with mirror therapy, where a mirror is placed in such a way that it appears as though the non-existent limb is present by using the existent limb. This can help some people overcome the pain that they're experiencing, especially in victims that feel as though their fist is being clenched, and actually going and flexing or clenching the existent fist and watching the mirror to go and replicate the non-existent fist and then releasing it can actually release some of the pain sometimes. So we're tricking the brain into not experiencing those sensations anymore. Furthermore, if you have time, you can also go and watch the video on the left, which goes and shows a dog that's also experiencing phantom limb syndrome. And here it's trying to itch itself, so this is a case of faulty adaptation, with the limb that is no longer present. The next thing we'll be talking about is the multiple choice question, and I really appreciate you listening to my presentation. Thank you. So thank you very much everyone for watching my presentation. My multiple choice question is, what is the main cause of phantom pain in phantom limb syndrome? Is it muscle spasms, neuromas, inflammation of the area, or the substantial nigra having overexcitement? The answer is neuromas, and thank you everyone for watching my presentation. I hope you learned something.